Chronic fatigue syndrome is one of those catch-all diagnoses that, in my opinion, unfortunately, as such, can become overutilized. Okay? Chronic fatigue syndrome and fibromyalgia, you'll hear very, very intermixed, because fibromyalgia is a very specific condition, but has a very broad definition. In that, fibro refers to connective tissues, myo is muscle, and algia is pain. So fibromyalgia has to do with painful muscle tissues or connective tissues. Okay? And basically what they look at for diagnosis are several tender points on the body. If you have these tender points, enough of them, then you're diagnosed with fibromyalgia. Chronic fatigue syndrome, though, often will include the fibromyalgia, the body pain, but it includes then the overwhelming sense of fatigue or inability to move, okay, or to get going. Often associated with a form of depression, and then also this pain syndrome. So let's look at a couple of things then that have to do with causes of fibromyalgia. Okay. First of all, when we look at potential causes of connective and muscle tissue pains, one of the most current or updated literary reviews is a lack of vitamin D. Vitamin D lack can actually create in the system a pain syndrome or a pain sensation that is a spontaneous pain without some type of a mechanical or some type of an appropriately stimulated pain response. So normally my pain response is I bump my knee on the end of the bed post and it hurts. Okay? With fibromyalgia, I just wake up and I have pain. I go to move and I have pain. So phantom muscle pains in one of the literary reviews has been shown to be an indication due to a low vitamin D level in the system. And again, what vitamin D level do we measure in the system? 25 hydroxy vitamin D. Okay? That's a serum or a blood draw, and we're always going to look at 25 hydroxy vitamin D, and I always like to see it greater than 60 and less than 120. That's the range that I like to keep it. And most of the times what we find is people with pain syndromes will have a low vitamin D level. Okay, so people with fibromyalgia often will have a low vitamin D level. Okay.
What percentage of the population, excuse me, off the boards, what percentage show up in the labs you see with low vitamin D?
Okay, so the question is, what percentage of people of labs that we do in our population have a low vitamin D level? I would say at least 80% and approaching 90%. Okay, especially where we came from Oregon last year. In the Northwest and these areas where we have longer winters, there is just a tendency or propensity to have low vitamin D levels. Okay, so always measure your vitamin D, and especially with these fibromyalgia or fibroconnective tissue muscle pains without some type of an organic or a true traumatic nociceptive or pain receptor response. Okay, so that's there. Let's take a look at another potential cause of fibromyalgia. Fibromyalgia can sometimes be a presentation of a post-surgical or post-traumatic event. So sometimes when we look at a person who's had a surgery, they'll actually exhibit some fibromyalgia type symptoms because their body still has a pain syndrome in it, or a reflex sympathetic dystrophy. Okay? So sometimes a reflex sympathetic dystrophy can be actually a presentation of what we're looking at as a fibromyalgia type of a catch. Okay? So one lady who had come to us, she had had a broken toe. After she'd broken her toe, she started to get pain that came up through her leg, and that pain continued to worsen until she couldn't even wear a stocking, couldn't wear any type of a shoe that was tight on that foot. But then it started to go systemically, and she was diagnosed with fibromyalgia. What she had, though, was a case of reflex sympathetic dystrophy, which was a post-injury impact or a trauma to her toe, which caused then this heightened sensation or sensitivity in the nerve receptors, and consequently then a systemic threshold of sensitivity that was firing spontaneously. Okay? So reflex sympathetic dystrophy may be another potential cause of fibromyalgia. Okay? What else can cause then this type of a presentation? How many of you have seen people with restless leg syndrome or heard of restless leg syndromes? Okay. Restless leg syndromes can be a manifestation of a couple of different things. Restless leg syndrome oftentimes is related to a lack of electrolytes in the body, and specifically magnesium or calcium, that causes then this spontaneous jerking or jumping. But we also see restless leg syndrome associated in males with prostatitis, or inflamed or enlarged prostate. Okay, so the male who is 40 plus, who starts to say, "Oh my goodness, I have difficulty voiding my urine. I'm noticing now that I'm getting more inflammation, I have more arthritis, and I'm starting to get muscle pains." Okay, it may be due to an inflamed prostate that we're actually experiencing restless leg syndrome. So pain on the insides of the ankles. If we actually squeeze the inside of the heel, very, very commonly associated with prostatitis. And when you look at the face of the man with an enlarged prostate, he can't hide it. Okay? The man with an enlarged prostate, you'll actually see it. I know I have some better markers. These are my kid markers. And I don't have Sweet Ashley here to help us out. Okay, when you start to see a man whose nose starts to become more bulbous and rounded at the tip, and then you'll start to see there will be some sores, these little spontaneous sores that start to occur on the tip of the nose or the end of the nose, you're actually looking at a window into the prostate. Okay, and you'll see it very, very commonly because the end of the nose will become very red, and then you'll start to see these little sores start to show up on the nose, and that it's very, very, very directly linked to inflammation in the prostate. The more sores that you start to see, the more irregular then is the prostate itself, and that prostate needs to be evaluated and corrected. But it actually will manifest in the nose. Okay, so an inflamed prostate can cause restless leg syndrome. Restless leg syndrome may be a manifestation, though, also of an imbalance in electrolytes. So we need to look at the electrolytes, which means then we need to look at the other aspect of the fatigue portion of this question mark here. So when we look at the chronic fatigue, the chronicity is I always feel tired. What conditions have we talked about this year that have to do with excessive fatigue, or my inability to start in the morning, my inability to maintain? Renee says it right there, and it has directly to do with adrenal exhaustion. Okay? When the adrenal glands are exhausted, we actually see then a presentation of systemic exhaustion. Okay? So remember, again, adrenal output is best queried by my sleep hygiene. Okay? Am I able to, 1, fall asleep? Number 2, do I stay asleep? Number 3, do I awaken refreshed? And then number 4, do I feel tired during the day? Wow.
There are people that feel this way, or that don't feel that way.
Yes, there you
Wow, I
go.
want to meet them.
Okay, tired during the day.
These are the exact same questions for obstructive sleep apnea.
Correct. Which also then, an obstructive airway is going to create this symptomatology, and the reason that it's causing that, or that inability to breathe, is placing a high burden on the adrenals. Okay, so it's a stress. If you can't breathe, do you think your body's an alarm? Absolutely. So the alarm glands will be constantly on. Okay, let me take a look and see if I have a non-child marker here, please.
I can start skipping.
What's that?
I can start skipping.
Yeah. I know I've got some. But I won't be able to locate him tonight. So, we've talked about that quite a bit, adrenal gland function, okay? For those of you who are newer, again, what are the adrenal glands? Two special glands that rest atop the kidneys, pyramidal shape. They produce adrenaline, they produce DHEA, they produce cortisol, okay? Which are all, in essence, stress hormones. Cortisol maintains our blood sugar during a fasting state, so at night when we're sleeping, we aren't feeding ourselves every 4 hours like we are when we're awake. So consequently, cortisol release allows the body to be able to sleep at night. When we don't have adequate amounts of cortisol, though, we awaken, so we have this disrupted sleep, because then the body either has to produce adrenaline or it has to kick the thyroid in to say, wake up, I need sugar. So it has to mobilize sugars from other areas and cause then this disruption in sleep. If I awaken refreshed, if I don't awaken refreshed, that means that in the morning when my cortisol levels should be highest, and then going down throughout the day, the cortisol levels are actually doing the opposite. So they aren't actually spiking in the AM. Okay? If I feel tired during the day, my cortisol levels may not be responding during the day. And sometimes if I can't fall asleep, then my cortisol levels are actually doing the opposite. So you'll actually see this person will have this type of a graph instead of the normal crescendo or descending graph presentation. So this person may actually say, gosh, why is it that by 10 o'clock everybody's going to sleep and I finally catch my wind? Okay, go ahead.
And so we self-medicate with
Correct.
caffeine drinks and sugar.
That's right.
And then
And that's our whole society.
Yep.
So what do? We self-medicate with 5-hour energy, with energy drink, Monster, Red Bull, whatever, to try to keep this response in a better flux. Okay. Where I came from in Oregon, there was a coffee stand on every corner, literally, okay, and because everybody was so addicted, and that's what they need to start their day. So it's in our society, it's in the world, it's very, very common, and it's what happens, okay. But what we're trying to self-medicate, just as Dr. Robertson points out, is adrenal exhaustion, okay. So recovering the adrenals is one of the steps to correcting chronic fatigue syndrome. Okay? What is another cause of chronic fatigue though? When I have the flu-like symptoms. Very commonly we actually find that to be the case, that at some point there has been an exposure to some type of a virus, Epstein-Barr virus. What does Epstein-Barr virus cause? Mono. Okay, so systemic or infectious mononucleosis, okay, the kissing disease from back in high school, is Epstein-Barr virus. And Epstein-Barr viruses do not have the ability to just live on their own like a bacteria. They don't have their own cell, nor do they have their own cell organelles to create and maintain and sustain their living entity. A virus is nothing more than a naked protein with a capsid inside, or a gene, that it actually has to go and light or land onto a cell and then inject its genome into a healthy cell and use the replication of the cell to be able to replicate itself. Okay? So once that gene has actively placed itself within or embedded itself within the genome of the rest of the cell, it is permanently there. Did you know that the biggest challenge of mapping out the human genome in the Human Genome Project was that approximately 30% of the human genome was actually viral DNA? And that's where the confusion came in. Okay? Pretty astounding, actually. Go ahead.